Hello everyone. Hope you all are doing well. Welcome back to my channel, where we try to make learning as simple as possible. In today's video, we're diving into one of the most important diagnostic tools in endodontics, clinical pulp testing. This is the must-know topic for your clinical life and helps you to diagnose the tooth condition properly. Let's start. What exactly is pulp testing? Pulp testing is a clinical diagnostic method to determine the health status of the dental pulp, whether it's healthy, inflamed, or necrotic. It's based on how the sensory nerve fibers inside the pulp respond to certain stimuli, which are either thermal or electrical. But here's something important: pulp testing evaluates nerve response, but not actual blood supply, which is true vitality. Why do we do it? It helps us answer critical questions before starting any endodontic treatment. Is the pulp alive or dead? Is it inflamed, and if so, is it reversible or irreversible? There are mainly two types of pulp tests. First is thermal test, which is further divided into cold testing and heat testing. Second is electric pulp testing, also called EPT. However, there are some pulp sensitivity and adjunctive tests, further divided into test cavity and selective anesthesia. Let's break these down. Starting with cold testing. This is the most commonly used and most reliable method, especially for diagnosing irreversible pulpitis. We commonly use agents like endo-ice, ice sticks, CO2 or dry ice, and refrigerant sprays. It is more effective on an anterior tooth than an insulated posterior tooth. Cold tests work by stimulating A delta fibers in the pulp via rapid temperature change. What you have to do: first, isolate and dry the tooth and apply the refrigerant spray on a small cotton pellet. Apply that cotton pellet to the dried and isolated tooth. The stimulus applied usually results in sharp, brief pain, which may occur regardless of pulp status. How to interpret the responses? If there is quick, mild pain that goes away when stimulus is removed, that is considered a normal response. Intense and lingering pain results in irreversible pulpitis. But if there is no response, this could indicate necrosis, but always confirm with another test. Consider doing EPT. Always compare the response with adjacent and contralateral control tooth. A false negative response is often obtained when cold is applied to teeth with constrictive canals called calcific metamorphosis due to reduction in dynamic flow, whereas a false positive response may result if cold water contacts gingiva or is transferred to adjacent teeth with vital pulps. This is an example of how to do cold test. Next is heat testing. HES testing is less commonly used as it is less reliable than cold testing. It is done only when a patient complains of spontaneous pain, relieved by cold. We commonly use materials like heated gutta percha, hot water, rotating a dry rubber prophy cup to create frictional heat, and a battery-powered device, touch and heat. It works on the same mechanism as cold testing, that is by stimulating A delta nerve fibers, which are myelinated and located in the periphery of the pulp. What you have to do: isolate the tooth first with rubber dam to prevent false positive responses. Apply heated gutta percha directly on the buccal or facial crown surface. After applying heat, the temperature is gradually increased until pain is elicited. How to interpret the responses? If the response is quick and mild pain, the tooth will be considered vital. Intense and lingering pain results in irreversible pulpitis. No response indicates necrosis. Always compare the response with the adjacent and contralateral control tooth. A false negative response is often obtained in tooth with tertiary dentin, that is formed in response to injury or trauma, whereas a false positive response may result in necrotic teeth with gases or in previously treated tooth as a result of untreated anatomy. This is an example of how to do a heat test. Let's move to electric pulp testing. It's a useful adjunct but less accurate than cold testing. It does not differentiate normal pulp and that with pulpitis and cannot contact composites or metallic restorations. How does it work? EPT produces a high-frequency electric current, creating ionic changes in dentinal fluid, by stimulating sensory nerves, mainly A delta fibers. How to do it? First, isolate the tooth. Scrub the surface with a cotton roll and dry thoroughly with air syringe. Then place a small amount of toothpaste on the electrode of pulp tester. An electrical circuit is established by using a lip clip or having the patient touch the metal handle. The electrode is placed on the facial or lingual surface of the tooth. The level of current is gradually increased until it surpasses the perception threshold. Sensation may be tingling, stinging, full, or hot. How to interpret the results? Positive response indicates the presence of nerve activity but not necessarily a healthy pulp. No response, suspect necrosis. Always compare the response with the adjacent and contralateral control tooth. A false negative response results in teeth with recent trauma or in calcified canals, whereas a false positive response may result in anxious patients, conduction via restorations. This is an example of how to do an electric pulp test. Next are pulp sensitivity tests, which include laser Doppler flowmetry and pulse oximetry. These objective tests measure blood flow and are more accurate for pulp vitality, but not routinely used due to cost and availability. The blood components are demonstrated by detecting oxyhemoglobin low concentrations of blood or pulsations in the pulp. The adjunctive tests, which include test cavity, done particularly in asymptomatic cases with deep decay. In this test, direct dentin stimulation is applied, meaning cavity will be done without anesthesia. A test cavity producing sensitivity is an indicator of pulp vitality. However, it is considered invasive and ethically questionable and is rarely done. The next adjunctive test is selective anesthesia. It is done when a patient cannot identify the offending tooth. It is done by anesthetizing the maxilla first by local infiltration from mesial to distally. After ruling out mandibular teeth are anesthetized, again moving mesially to distally. These are some factors that affect the results. Age of the patient, existing restorations, traumatic injury to tooth and calcification of tooth. Some important clinical considerations. Before testing, always, take a detailed history. Compare with the contralateral tooth. Isolate and dry the tooth properly. Avoid metal restorations that may affect DPT. And most importantly, never base your diagnosis on just one test. These are most asked questions in clinical exams. If you want answers to these questions, comment below. That's it for today. If this video helped you even a little bit, give it a thumbs up and subscribe for more clinical guides and dental study hacks. Thanks for watching, and I'll see you in the next video. Stay sharp, stay smart, and keep learning.